The doctor is in today, and today it's pediatrician Dr. Robert Wittrock from the Ascension St. John Pediatric and Adolescent Medicine. And today a very important talk, talking about the importance of getting your kids vaccinated for the flu. Now, as you're talking during the break, there's concern about the flu this year.
Right, yeah. So as we all know, we've all been kind of thrown into being amateur epidemiologists since the pandemic's been going on. Flu really hasn't been as big of an issue the last 2 years. This year's is expected to be pretty rough. Usually we look to Australia and other southern hemispheres to see what their flu season is like, and it's been a little bit rougher for them, so we expect our flu season to be a bit more rougher too. A lot of the precautions that protected us from COVID, masking, distancing, aren't really in effect as much anymore, so flu's going to be able to run a little bit more rampant this next year. Flu, obviously, we're worried about it. It's kind of the king of colds. Higher fever, higher risk of complication. It tends to get the vulnerable population a bit more sick. I'm talking the very young or very old, or people, with immune suppressants and things like that.
For vaccinations, when should parents get them vaccinated?
Yeah, so anybody who can get the vaccine should get it. A kid can have it as early as 6 months of age. Before that, I just recommend that the family around the baby get the vaccine, okay? Usually with the first vaccine, they'll do a booster shot about a month later, but that's the only time you'll ever need a booster, okay?
Now, which versions of the flu vaccine do you recommend?
Any one that you can get from a clinic is probably the right one. There's different kinds of shots. There's actually a nasal spray that's a flu vaccine that certain clinics kind of have. And the nasal spray is not for everybody. It's more for people who are otherwise healthy for the most part. But it's quick, it's effective. Yeah, it has a higher complication rate and a lower risk of, the flu itself has a higher complication rate and a higher risk of death compared to other kinds of colds and other respiratory illnesses. So that's why I say not only to protect our vulnerable population, to protect ourselves too. I know some companies will save tons of money, tons of time saved at work taken off just if they mandate the vaccine within their company as well. So it's really important to get for everybody.
Now, getting flu-like symptoms after getting the vaccine normal?
Yes.
How do you treat that?
Right. So the usual flu-like symptoms that we'll see is just basically an immune response that you could get after any vaccine that you can get. Usually it's body aches, chills, maybe some soreness. I got my flu shot last year and I'm still a little bit sore right here. But you shouldn't necessarily be getting the cough, the runny nose, the cough, congestion, things like that.
Awesome. Well, thank you, Dr. Wittrock, as always, for being here. Very important information for parents and for kids.